To enhance a woman's overall health and well-being, early detection programs are imperative. They help raise awareness and they help women manage different health conditions. Cervical cancer is a serious health issue and is actually one of the most common cancers found among women worldwide. That's why regular screenings are so important. We're excited to have Dr. Nimra Amir Dad with us today to answer these questions. Dr. Nimra Amir Dad is a consultant obstetrician and gynecologist and is currently an attending physician at Sidra Medicine. She is a graduate of Weill Cornell Medicine, Qatar, and specializes in laparoscopic and robotic gynecological surgery. Dr. Nimra completed a fellowship in gynecological surgery in New York, is American board certified, and is a fellow of the American College of Obstetricians and Gynecologists. Reproductive health is often thought of as being tied to pregnancy and childbirth, but actually covers much more. According to the World Health Organization, reproductive health is a state of complete physical, mental, and social well-being in all matters related to the reproductive system. So it's not just about the absence of disease. This holistic view applies to both men and women and covers all aspects of reproductive functions and processes. Contraceptives play a crucial role in public health by helping to reduce various health risks. Let's watch the following report to find out more.
Contraception is an important part of modern life and plays a crucial role in improving the health of individuals and societies.
There are short-acting and long-acting contraceptive methods. Short-acting includes barrier methods, pills, patches, rings, injections. Long-acting includes intrauterine device and implanon. Pros are basically you can plan your family and take care of yourself and your health conditions before having kids. Cons are the side effects, basically irregular bleeding, breast tenderness, headaches.
Family planning offers families a degree of control over their personal, economic, and social conditions, while health institutions and organizations see it as a key step toward improving education and healthcare access.
Dr. Dad, contraception is an extremely important topic. So what are your views in terms of the different types and really where the positives and negatives lie?
So basically there are two types, short-acting and long-acting. So short-acting includes basically most of the things like pills, patches, rings, injections. Long-acting ones are the ones that are there for 3 to 5 to 10 years, which are like intrauterine device, implanon, and the permanent sterilization, which is like cutting of the tubes. So those are all the options. And the pros and cons, I will say pros are like you can plan when you want to conceive based on your health, your well-being, your socio-economic status, basically everything. And also you can manage your health conditions that you were aware of or you were not aware of beforehand. And cons, I will say, are mostly the side effects, which are like irregular bleeding, pregnancy-like symptoms, breast tenderness, headaches. All those, I will say, are the cons.
And would you say that, it's recommended for a lady to kind of decide on the contraceptive method that she will use alongside her physician?
Definitely, because she's the one who's going to use it. So if she doesn't feel comfortable with it, either she will discontinue it early or we will say like the method will fail for her. So she has to choose. There are so many options that will actually work for her, but she has to choose which one will work for her and she would like to continue with. So it depends largely on the patient.
What about early menopause? Generally, if you can just describe what is menopause?
So basically menopause, we diagnose it retrospectively based on like person having no periods like for 12 months. And patients usually will start having symptoms early on, like in the perimenopause period before the final menstrual period that they will have.
And what age are we talking about?
51 and a half, like that's basically the average. People can have early menopause, people can have late menopause, so it depends, but that's the average age. And the symptoms that usually they will start experiencing even beforehand, the most common is hot flushes. That's what brings the patient. And the other thing is the things that can affect their relationship, which is basically sexual dysfunction resulting from vaginal dryness and mood swings, irritability, all those.
And what is there that can be done? Is there some kind of magic pill that could kind of make it go away in terms of symptoms?
I wish there was something, but definitely it's like we start a method, we will see like if the patient is accepting it based on the side effect profile, is she feeling a difference? If not, increase the dose, decrease the dose, or change the method. So there are two options. One is like hormonal, the others are non-hormonal. So those are the ones that we usually recommend.
Okay, doctor, let's have a look at some relevant key facts before we continue our conversation. So, doctor, what are the treatment options for people going through early menopause?
So there are hormonal options, there are non-hormonal options. Hormonal options basically includes the hormone replacement therapy, and it comes in different forms like patches, topical gels. Then there are local options if the patient just has vaginal dryness, and that's the most bothersome symptom for her. Those are suppositories and gels and creams. And non-hormonal options are basically more of like the medication that controls the central nervous system through the brain. So basically, those are like under the category of antidepressants.
And so, are there any side effects really that come with these treatments?
So definitely there are side effects initially when the patient will start, just like the contraceptive options. If the patient will start in the first 3 to 6 months, they can have some irregular spotting, which is common because they're starting a hormonal method. The other things are like there's increased risk of having blood clots, breast cancer. But when you look at the basically not using this therapy and going through the symptoms that they are, and it's affecting their daily life and these risks, they're basically on the very, very low side. So that's why we promote, like if the patients are having symptoms severe to moderate, they should go towards these options. And the antidepressants, definitely they also have like some kind of like sleepiness, some change in mood. They might feel it a bit different. So those are the other side effects of the antidepressants.
But this naturally regulates itself.
Yes, so that's why we always say like, okay, try the method and see for 3 to 6 months how everything is going. And if you come back and you're like, no, this is not working for me, then we can change the method.
And how does the doctor actually decide whether to put, a patient on hormonal or other forms of treatment?
So it depends on the patient herself. One of the things is like depending on her profile, like if she has diseases like previous clotting history, herself had breast cancer, or has very significant family history, and she's a family history has like they are gene carrying, like BRCA1 or BRCA2. Herself, she's a carrier. So based on that, you can say like, okay, whether she will go towards hormonal therapy or no. The second is her own choice. A lot of patients get scared of using any hormones because of these risks that are there. So they don't want to go towards hormone therapy. They want to go towards something that is non-hormonal. So it basically depends on her medical profile and her choice.
So, doctor, at what age would you recommend that a young lady gets a smear test?
As per the guidelines, she should get it at the age of 21 or once she starts become sexually active.
And this is to be repeated every...
So depending on like her age, if she starts at 21, she can repeat it every 3 years because HPV testing is not required at the age of 21, just the pap smear, the brush test, the cytology, that's it. But above the age of 25, when we combine HPV testing with the pap smear, like swab test, then 5-year interval because you're basically testing for two things at the same time. So then it can be increased to 5 years.
Just to kind of wrap up, doctor, any final words? What advice would you give women in terms of looking after their health?
I will say they should take care of themselves because when they take care of their family, their husband, their children, their own health goes in the back. So it should be brought in forefront because if they will be well, they will be able to take care of their family. So they should always schedule a visit with a physician. Even if they don't have any issue going on, just come and say like, I want a gynecological checkup. And then the doctor will take care of telling them like what steps to take next, when are the screenings due, and what she can do now.
Thank you, Dr. Nimra Dad. It's been an absolute pleasure having you.
Thank you.
During this discussion, we focused on the importance of detection. So join us for an in-depth conversation with Dr. Nimra Amir Dad on prevention and treatment. The full podcast is available on the Sehatuha website and on WCMQ's digital platforms. Thank you for watching.